Hello, my name is Brianna Kugelmeister, and I'm going to be doing my final project on nursing burnout. Um, so I just thought of the fact that this is going to be backwards, but my goals for this project was that by the end of this project, I will identify 3 areas of nursing burnout and come up with 3 interventions to prevent nursing burnout to bring forth to my management at work. Um, and then identify areas in my work as a nurse myself that I get burned out and what solutions that I can use to help me prevent nursing burnout. So, the first thing is, what is nursing burnout? Burnout is defined in our text as an exposure to high levels of emotional and physical stress over an extended period of time. So, everyone experiences some kinds of stress in their work from day to day, but when we encounter that every day, it can build up and lead to burnout. And burnout does affect more than just the nursing career, it can affect any profession. And as of right now, there are 7.2 million global shortages of nurses or healthcare workers, and that number just keeps increasing as the population gets more sick, and a lot of the nurses are getting up there in age and retiring as well. And because of this increase of burnout in the nursing profession due to shortages and other things, we're seeing a lot more research being done on what is causing burnout and how we can prevent it as well. So, some causes of burnout, obviously the stress, occupational stress. We're in a high demand field, and it seems that our workload continues to get higher. And cutting costs in healthcare, it's increasing the workload of nurses. More and more facilities are making cuts. For example, at our work right now, we're attempting to cut 200 FTE throughout the system, and majority of those FTE are in the nursing staff, which does put a lot more work on every nurse because now we have less staff, higher patient loads, and it just seems that the acuity of our patients continues to get higher and higher. Job satisfaction. There's so many times that nurses are leaving work feeling like they missed something, feeling like they didn't do the best they could, feeling like their patients didn't get the best care. And that really wears on a nurse and makes them feel like they are just not satisfied with the job that they're doing. And then, depending on the area of nursing that you're working in, there obviously are different areas that have a much higher area of burnout. For example, I work in oncology, and in some of the research I was doing, it did say that oncology is one of the highest burnout due to the emotional attachments and dealing with death and dying in families. It can be a lot of stress on nurses. And then the workload, as I said before, the amount of work needing to be completed in a day. Nurses have unexpected events happening throughout the day, such as deaths or colds or patients tanking, not going the way they thought. And then on top of that, there's admissions, discharges, and other things throughout the day that just compile onto the nurse and can cause a lot of stress throughout the day. And with all of that extra work going on, by the end of the day, nurses are extremely drained. And a lot of times we're skipping lunches, skipping breaks, and just adds on to the stress. And then the control, decision making, a lot of nurses feel that they don't necessarily get to be part of the decision making for their floor. And it all depends on the type of management that you have, whether or not you get to participate in those decisions. A lot of times nurses feel that they're helpless or powerless in those situations, as well as feeling hopeless with the patients and feeling like they just can't, you know, fix their patients. And then another cause would be rewards, that recognition, raises, and bonuses. A lot of times nurses aren't getting those, or raises are being cut because of the budgets. And a lot of times nurses go unrecognized for their work simply because um, it's not seen or management's not there, and that can really wear on a nurse not being affirmated that they are doing a good job. And then working with the community can be a cause for burnout. Feeling like they're an outsider in the community of their teammates, isolated. A lot of times when you start a new job, a lot of the nurses have been there for a long time, and it can be hard for that team interaction. It's hard for that new member to maybe ask for help or feel like they're being supported because they're new, or some nurses just might not click with the rest of the staff. Or I know on our floor and in nursing in general, it's majority women, and a lot of times that can cause cliques and people can feel left out. And then fairness. A lot of times people feel that their management might play favorites, or again, with that feeling outside, that can cause burnout. And then just values, feeling like you're working towards a mission, being part of something larger, and helping the health of the community. A lot of people feel that the facilities are more about the money rather than the patient care, and that the values aren't in the right spot. And that can really, really have a negative effect on the environment that you're working in. In one of the studies that I had read about, it was done in 2011, and it asked why people leave their jobs and why they feel burned out, or why the burnout causes them to leave their jobs. And the number one reason was because people were not feeling satisfied with their jobs anymore. That high level of stress, loss of or less control over their job schedules. They weren't, having that flexibility, or they were getting forced over, or mandatory overtime, things like that. And higher levels of education and being male were also found to be reasons why people left their jobs. So what effects do the burnout have on the nurses and the patients? Nurses can fall physically ill because of the lack of sleep, the constant draining emotionally, physically. There are a lot of psychological issues that nurses can have being around the sick, dealing with death and dying. A lot of emotional attachments can be formed, and dealing with those family members. Sometimes the family members can be a lot to deal with. I know on our floor there's a lot of times when the family really is a struggle for us to deal with appropriately. And then lack of sleep. A lot of nurses work shift work, or they're working rotating schedules, or all nights, or just 12-hour shifts in general. And then a lot of times with the nursing shortages, we're working 16 hours instead of just 12, and then having to come back, and then trying to juggle a family and social life on top of that can be a lot. So that all can cause emotional exhaustion. Depersonalization, and that's when nurses form negative feelings about the patients that they're caring for. I read a study, and it said that depersonalization and emotional exhaustion and reduction in personal accomplishment were all three things that were major effects on nurses. And that reduction in personal accomplishment just means that the nurses have a negative feelings towards themselves and about the care that they're providing for their patients. Like I said, a lot of times Nurses leave and they feel like they're not getting, they didn't do everything they could have that day. And it's not because they didn't want to, it's because they're running around and things, have to get put on the back burner. You want to walk your patients 3 times a day, but when you have a patient that's coding or a patient that's going downhill and needs your undivided attention, those patients that aren't, or that you want to walk, aren't getting the walk because that's not really a priority to a patient that's not doing so well, unfortunately. And absenteeism is something that we see a lot with nursing burnout. And then nurses have physical issues as well, musculoskeletal injuries. They're exposed to chemicals on our floor. We're hanging chemotherapy, and there's been numerous times where we've had exposures to the nurse and the patients. And like I had said before, those irregular hours really can cause some physical issues to the nurse themselves. So what can we do to prevent this burnout, or at least kind of help cope with it? With that excessive workload, making time for the staff to be able to take breaks and maybe go outside, take a walk just to clear their head for 5-10 minutes, just to get away from it. I know sometimes just leaving the floor, not hearing those call lights, and everything can really rejuvenate you for the rest of your shift. And as a lead on the floor, I know I try really hard to make sure that the staff members can have time to go do that. And then time management, making sure that the staff members prioritize, like when they do have a few minutes of downtime, get that extra charting done, and get some of those meds passed before you get an admission, or it's the end of your shift and you realize that you still have tons of charting to catch up on. And then learning to delegate. That was a hard one for me to learn, because a lot of times I felt very bad asking other people to do things when I know that they're as busy as well. But it always seems like one team is a lot heavier than the other teams on the floor. And we recently just switched to primary nursing. So we used to have LPNs, and now we don't have them to fall back on. But having smaller teams can help some of the nurses to maybe have a few minutes to help you do something, or just that team effort is really important to make sure that everyone gets their work done and does it without feeling overwhelmed. And then making sure to ask for help when needed, and try to do some more relaxing things at home. It's hard with work, life, social balance, but making time to be able to relax is one thing that can really help you rejuvenate to be able to come back to another 12-hour shift. And then also maybe form a group to explore different technological advances that can help reduce that workload. For example, on our floor, we are going to be trialing having iPhone-type phones that we carry around that can also scan medications, that patients can press their call light and I'll send a text right to the nurse, asking for a pain pill or asking for water, or so that you're not having to take the time to walk into the room, find out what they want, come back out, grab whatever. It can just be grabbed and then brought to the room, just to save time and ultimately make more time for the patients. And with the lack of control or feeling helpless, some interventions, support groups, and having a counselor on site, especially working with oncology, there's so many times that you get attached to your patients and you just might need someone to talk to. Maybe even just having the managers take extra training to learn to help their staff with coping. And then pastoral care. I know our hospital offers pastoral care for the patients, but making sure that that could also be available to the staff as well. And then as far as burnout with feeling rewarded, having ladder programs for salaries, making sure that everyone has a fair chance at going up the ladder, um, and then tuition reimbursement, um, rewarding people for going back to school or furthering their education. And then if your job doesn't supply you with any of those things, looking for a job that does have benefits so that you do feel rewarded in what you're doing. And then providing time for staff to voice their feelings and promote outside work activities can really help as far as that teamwork community aspect. On our floor, we try and do outings at least once a month, well, once every other month maybe. We've gone to gambler games. We've did like a Pinot's palette painting. And it's just nice to be able to get your coworkers outside of work. It really helps that bonding and seeing each other, not in a work setting, can really help those relationships at work, and maybe get to see a side of someone that you don't normally. And then as far as fairness on the floor, in regards to feeling that there's favoritism, making sure that managers have continuing education, and then having retreats for staff and management. Again, having that time together outside of work in a relaxed setting is really helpful. Having employees of the month so everyone can feel recognition for things that they have done. On our floor, we have that. We have applause cards we can fill out for each other when we see somebody doing something well, and that really does help people feel like they're being recognized. And then all of those go into a drawing, and that's how we pick our employee of the month. So it's fair. It's not, based on favoritism or anything like that. And then being able to do self-evals for like your yearly performance. We do that as well as have peers review you as well as management review you. And it all gets compiled into one, so that if you were ever to get a different job and they had to look at your reviews, it's not just based on one person. It's based on numerous people that you work with, so it's not biased. And then as far as values go, having charity events, newsletters for the floor to recognize outstanding work, patient and family support groups, being able to provide your patients with groups outside of the hospital that they can attend, especially in oncology, those support groups with those family members that have a loved one going through the battle of cancer. It can really help, and it can make you feel like rewarded as a nurse knowing that you're helping them rather than leaving feeling like you just didn't do everything you could for them. And then therapies for patients. And we have music therapy that we actually just recently got on our floor, and it's great for the patients. And then some other areas of interventions that I found for nurses to cope with burnout. Expressive writing or other creative expressions of feelings. Along with that music therapy that we have, we had one of the therapists that comes to our monthly meetings for our floor, and she actually had us do expressive drawings where we picked 3 words that were describing how we were feeling or related to us, and then we all drew a photo or a picture of what we were feeling, and then everyone went around and explained how their picture related to them, and it was surprising to see how many emotions people actually let out to share with their coworkers. And I would say that majority of us felt a little bit more relieved about being able to express that with our coworkers. And then, like I said previously, retreats with staff and doing outings. And then relaxation techniques and self-care, making sure that you're taking care of yourself. And I know at our work, once in a while, we'll have a masseuse come in and do 5 to 10 minute massages for the staff. And like I said, just being able to get off the floor for that 5-10 minutes is huge, as far as being able to help with burnout. And if burnout is prevented on the floors, you're going to see increased job satisfaction for the nurses. They're going to feel important. They're going to feel like they have accomplished something while they're there. And they're going to feel pride in their work, which is extremely important. Um, and you're going to have a healthy working environment, those team aspects, those close-knit relationships. You're going to have staff that's going to want to stay, that are going to want to come to work. You're going to see reduction in turnover, and then also when nurses feel that they're being recognized and happy, they're going to be more productive and they're going to want to work. So, all right, well, that is all I have. Thank you for watching.